measles today.
Sure.
Sure.
Let's talk about measles.
Let's talk about measles. It's made its way back into the news here.
Unfortunately.
Yeah.
So we have had 8 confirmed cases in Indiana. They all were located in Allen County, and they are all from the same group of people. So the good news is that the transmission period for that has now more than double the time that the transmission period would have happened, so we are now considering this outbreak pretty much over. So this particular one. Unfortunately, the reasons for the outbreak is a lack of vaccination, and so this could happen again at any time in any community in Indiana, actually.
All right. So, Dr. McCullough, as you kind of sit back and seen everything with the measles going on, what's some of the preventative measures that you can take as a parent to...
Well, the most important one, of course, is the vaccination. The vaccination is extremely effective. It's been around since I think it was 1963, and the safety has been well demonstrated. One dose of vaccine actually gives you 93% effective protection. Two doses of the vaccine get you up to 97%. And of that small number of people that even if they're vaccinated and they're unclear exactly why this happens, that their immune system didn't respond, even those people will get a significant protection from it where they'll get a much milder disease. So the number one prevention is vaccine.
All right. Now, Sean, at the health department, you're able to offer those vaccines.
We sure are. Those are part of the routine childhood vaccinations, and we give those to parents whenever they come in for them and need them. We typically follow the CDC's vaccination guidelines on all of our vaccines, and that's one we always have on hand and is available for really for the age group that it's recommended for, but also anybody who hasn't had it, we can get them up to date on their vaccines as well.
So when we're talking about measles, what are some of the signs or symptoms that we should be looking for if you're afraid that your child may have contracted it?
So it's been a long time since I've seen measles, so I had to look this up because I wanted to be accurate. So measles symptoms appear 7 to 14 days after that initial contact, so 1 to 2 weeks. The most common symptoms are going to be a high fever, very high, like up to 104, nasty cough, really watery, runny nose, red, watery eyes, not like what everybody thinks of pink eye with pus type stuff, but just really watery. And then the rash, and they kind of go in an order. You get those initial symptoms of that fever, cough, runny nose, eyes initially, then the rash will start. And unfortunately, you're contagious. Same as anything where you're coughing, sneezing, that's where you're contagious. So before you even really realize you have the measles, you have been contagious for at least up to 4 days. And the rash, it's a very particular kind of rash. Starts kind of in the face, up at the forehead, and then spreads downward. And it's what's called a maculopapular rash. So it's not like little blisters like chicken pox could look. And people do get, this is very an obvious symptom then of measles. It's called Koplik, and I may not even be saying that right. It's Koplik, spots in the mouth, and that happens before the rash. And they look like small little red areas, bumps, with a wider kind of bluish center. And that'll be mainly inside the cheeks, especially back by the teeth, but it can be all over. So it's painless. They don't hurt. But if it's not like a cold sore or fever blister, it's not going to be just one. You're going to get a lot. So people that see something in their mouth, don't panic. That's unlikely, but that would be something to watch for.
Now, if you do end up with measles, is there any treatment for measles?
In certain patients, if they're immunocompromised, you can get immune globulin. If somebody thinks they've been exposed, the key thing is go get that vaccine if you are not vaccinated, because even it starts giving protection within 3 to 5 days. It's not going to be full potency for protection until a couple weeks. But if there is an outbreak anywhere close to you and you're not vaccinated, my goal would be to get those people vaccinated. But even if they've been exposed, but the one key thing, obviously you got to get diagnosed. when you call the doctor's office, if you think you might have measles or have been exposed and think you might have it, you need to tell them so that they don't bring you in the front door and sit you next to a newborn or something. That's just very important. But it would take a medical professional, a doctor or a nurse practitioner, really to diagnose it. So.
All right. And then how long do you typically have those symptoms?
It overall runs, I think, about 2 weeks from the time that you first start, and before the rash is going away is probably about 2 weeks. You're contagious for up to, I think it's 4 days after the rash. I'm trying to remember if it's starts, I think. So up to, well, I wrote it down. You're contagious for 8 days total. The problem is, where does that start? So
kind of, it's not hand, foot, mouth. I'm just going to relate it to that. It's you're contagious before you really know that that's even what's happening.
Mm-hmm. Yeah.
So, yes, Dr. McCullough did her research today.
I did.
Yes.
Well, and the numbers, if you're not vaccinated, 9 in 10 people are going to get measles. It is that contagious. It's an extremely contagious infection.
And it
is the
spreads
problem,
quick.
right?
It will stay in, like she was talking about, coming into the waiting room in the doctor's office. It will remain in that room and be contagious for up to 2 hours after you leave. So it's just one of the most contagious diseases known to man.
And again, the active cases that we had in Indiana are now resolved, that were in Allen County.
Correct.
Right. But we still need to be aware.
Yeah.
This is.
We've had 1,024 cases in the United States this year. We had about 1,200 in, I forget what, 2019.
2019.
And we're not even halfway through this year yet. So that was the highest year since 2000. And 2000 was eliminated in the United States, completely eliminated. And now this year we've had 1,024, so we're on track for over 2,000 for the year. And we've had 3 deaths from that, 2 children and 1 adult. So it's a very highly contagious, very serious illness. Even if the deaths, 3 out of 1,000 is very high for any communicable disease, but also the serious illness that comes with it has led to many hospitalizations.
Is there a definitive reason that we're seeing measles come back?
Just lower vaccination rate. But we've always had populations in our country that chose not to get vaccinated, but it seems more people are not pursuing vaccines in general, whether that's going to include the MMR. It's hard to get those statistics, but we do have some pockets around our area that do not routinely vaccinate, so we're at risk. And then the rest of the world is at a higher level overall of measles. Actual measles cases, 2 out of 3 cases that are brought into the United States are by American citizens, not immigrants, but by American citizens that have traveled. They weren't vaccinated. They got it, brought it back, maybe not even realizing they were sick, or, if they were, God forbid, sick on the plane, then they certainly exposed a lot of people. But it's basically through travel is where it's coming back in.
All right. So for those of you listening and you're thinking, I don't know if I'm vaccinated, I don't know if my kids are vaccinated, how can the health department help with that?
Yeah, they can just give us a call and we can look at their records. Every vaccination is recorded, both by whether it was done by your physician, whether it was done at a pharmacy, or whether it was done at the health department. It's all recorded. The state of Indiana maintains those records, and we're able to look at it and see whether you're vaccinated or not.
And if they're not and they need a vaccine,
just show up. We are open late on Wednesdays. Sorry, I had to think about what day of the week it was. Till 6 o'clock, and then we're also there every day from 8 to 4. I would advise calling ahead, just make sure our nurses are in. It's not lunchtime. Somebody's there to actually give you your vaccine, but yeah, we're available and have vaccine in stock.
All right, so Dr. McCullough, over your career, you said, you haven't seen measles in a good while, but I guess just kind of walk us through that transition over as vaccine rates had went up and now we're starting to see them kind of slide back. What does that look like in your career, I guess?
Well, again, I've been lucky. I've not seen measles since I was a kid, but I'm at an age where I have that natural immunity because we all used to get it. I have a brother that wound up in the hospital with encephalitis due to that, measles encephalitis. So it was pretty scary. They thought he was going to die. He was at Riley. So I did look up some statistics because I found this was kind of interesting because I really didn't know. But before the measles vaccine really started in '63, 3 to 4 million people got the measles each year in the U.S. 400 to 500 died every year.
Wow.
Yeah, I didn't realize it was that high. 48,000 were hospitalized, so think of the cost with that, and the lost work hours. 1,000 had encephalitis each year, so these are yearly numbers. And my brother was one of those, so I still remember it. So there was apparently, and I had forgotten this, there was a killed vaccine, not a live virus, from '63 to '67. So there is some suggestion that if you would have been in the age range of getting it between 63 and 67, you either might think about getting tested for measles to see if you're immune, or think about getting the MMR, the measles, mumps, and rubella vaccine, which would not cause a problem even if you had it before. It's not a problem.
So for someone that doesn't understand the difference between that live and dead vaccine type of thing.
Okay. So there are some vaccines where the virus is completely killed. Then there are other vaccine where they use the term attenuated, where it's been weakened, or just uses a well, I guess the killed would be the portion of the virus. So, but the attenuated, so the MMR vaccine we have now is an attenuated vaccine, meaning the virus has been so weakened that it cannot cause illness, but it will make your body realize that, oh, that virus is in there, and I'm going to make antibodies to fight that if I see this again.
All right. And how long does it take the vaccine to, once again, be effective?
It actually starts helping within 3 to 5 days, I read. So it's still worthwhile even if you've been exposed, but up to 2 weeks, I think that's pretty typical for most vaccines to really get their full potency starting.
Now, Sean, if let's take the doctor's office, for example. Someone comes in, they end up having measles, they're in the waiting room, or say we're at a school and have the same situation. How do they go about the cleaning and processing that?
Well, unfortunately, it's an airborne. There's not a whole lot they can do in order to clean. That would be a nightmare, honestly, because we'd have everybody who had been in that room for 2 hours was potentially exposed to the virus. So we would hopefully they're all vaccinated. If not, that's, as Dr. McCall just said, it's not too late to get your vaccine if that were to happen. Same in a school. Time is about the only thing. We do recommend cleaning surfaces, much like we did during COVID, the enhanced cleaning schedules and that kind of thing, because there is the possibility of getting contact from a surface and then touching your eyes or your nose or your mouth and getting the virus that way.
And you said 2 hours, right?
2 hours.
It stays around.
Mm-hmm.
All right. Well, let's take a quick commercial break. We'll come back, and we've got more to talk about on Sheree Country 1330. Tree Country 1330 WTRE coming back with the Decatur County Health Department today. And we're talking about measles because measles have made their way, not back, but have been more prevalent here in the United States. Sean, you were saying just this year alone, we're looking at doubling what was reported in 2019?
Well, yes, 2019, which was the highest year we'd had since it was eliminated in 2000. Unfortunately, we've seen a pretty steady growth. It did drop off a little bit after 2019, but a lot of that was because of the precautions we used for COVID. So the masks and the social distancing and that all worked, and then now we're seeing it come back with a vengeance, unfortunately.
And our vaccination rates compared to other industrial countries are a little bit different.
Yeah, actually they're dismal. We, as a country, in 2015 is the last data I have for this, but we were at 74%. I doubt that has gotten any better. Even countries like China, 99+%, almost 100% of their people are vaccinated against measles. Russia, Germany's at 97%. The United Kingdom's at 95%. So almost every industrialized country is far ahead of us. Now, I will say, in Indiana, our vaccination rates we're at 84.6% in the state for the MMR, which is measles, mumps, and rubella. So we're a little higher than the national average. And I'm happy to say in Decatur County that 91% of our population is vaccinated for MMR. Unfortunately, we need 95% to have true population immunity. So we still need to get that last 4%. Ideally, we get the last 9%.
Now, Dr. McCullough, what comes along with measles, though, it's not only just contracting and having the measles process, but then there's a lot of other complications that can occur.
Yeah, there are potentially other complications that can happen. The most common, and it's most common in kids less than 5, pregnant women, immunocompromised people. The number one thing for kids was 1 in 10 are going to get otitis media. And anybody who's been up at night with a screaming kid with an ear infection, get ready for that. Diarrhea, it was slightly less than 1 in 10, but that can be devastating the younger they are, especially a baby. The more severe reactions it can get pretty dire. 1 in 5 unvaccinated people in the U.S. are hospitalized when they get this. Pneumonia happens in 1 in 20 kids, and it's the most common cause of death in the children. Encephalitis happens 1 in 1,000 kids, and it can cause seizures, deafness, intellectual disability. I mentioned my brother had this.
Yes.
I recall he had a seizure at the time, but it might have been because of the high fever. But luckily, he did not have any long-term effects. But between 1 and 3 out of 1,000 kids will die from either respiratory or neurological complications. So this is not a benign little disease with a rash that people should get over with. During pregnancy, it can cause premature birth and a very low birth weight, which can then set them up for problems for the rest of their life. There's one other late complication that is very rare but devastating. It's called subacute sclerosing panencephalitis, or they use the initials SSPE. It's rare. It's a fatal disease of the central nervous system, and it happens 7 to 10 years later. And the younger you are when you get the measles, the more your risk is that you would get that. So it doesn't happen often, but it definitely happens. So,
and that's just attributed to laying dormant in your system?
I really didn't read up on that. I'm not sure they know
Okay.
because it happens so rarely. But again, I just really want to point out that before we had the vaccine, 400 to 500 people died every year. Now, if we had a jumbo jet, that would be about the same number of people, I believe, going down every single year. I think we'd be looking for a way to stop that. So I think that's why they came up with the vaccine. They did stop it for a long time, and we all hope it stays at a low level.
Now, let's talk about the vaccine a little bit, because people are making choices not to vaccinate their kids based on information that's been out in the media, I guess, more or less. So do you want to touch on that a little bit about why they've...
There was a study, and I think it was 1993 maybe was when this came out, if that adds up. And it was by a doctor who I really don't even want to say his name because he really basically came out later. He totally falsified his data, or he was publishing, and he was published in the Lancet, which is a very respected medical journal. But turns out in a study, he only had like 11 or 12 people in the study trying to link the measles, mumps, and rubella vaccine to autism. A study with 12 people is a pathetic study. I mean, I could do a study and prove that all people have blue eyes by having 12 people in a room with blue eyes. An adequate medical study really requires very large numbers. Since that article came out, that study has been done, and they have totally debunked what he came up with. Unfortunately, because of social media and I think just people's fear, they carry this notion on, and it's totally false. There is no association of autism with the MMR vaccine. Never was.
So it is a safe thing to do. It is prevents a tremendous amount of issue that could be.
Yes.
All right. Now, Sean, down at the health department, you guys, again, offer the MMR, but you also offer all childhood vaccines.
We do all childhood vaccines as well as tetanus shots. We have some of the adult vaccines as well. We don't have travel vaccines, but pretty much any routine vaccines we carry.
Okay. And I know we're working on getting some more time set up with you guys to come in and talk about the different things that the health department offers, but just kind of give us a rundown quickly of some of the other things the health department takes care of.
Oh my gosh! So
how much? I don't think we only got 5 more minutes.
The major divisions of the health department. So we have the vital records. That's where you can get your birth and death certificates.
And you can now get your birth certificate from any
county in Indiana. Yes. Now we do run into a few problems once in a while, but we can get it. I can't guarantee we can get it while you are standing there because sometimes we do have to contact that county. But yes, we can get you a birth certificate no matter which county you were born in Indiana. That is only for the state of Indiana, however.
And it's acceptable at the licensed branch.
It is. It is a fully documented birth certificate. Is the certified copy. So we also do sanitary type inspections. So we inspect restaurants. We inspect septic systems. We do unfit for human habitation, which means that a home that is causing unhealthy conditions for the occupants, we will investigate those and order cleanups. We do pool inspections, we do tattoo inspections, eyelash extension inspections. So there's several things in the sanitary area that we do, and then we have our nursing division, and as we already talked about, we do the immunizations, but we also do some wellness checks and that kind of thing. And one of the things I'm really excited about is we call it our vital health something about traveling. Now I can't even think of the name.
I can't think what it is.
Vital health route. And so we have 2 nurses who are going out to remote locations. We're going to Westport, St. Paul, New Point, some others in there. And we are offering our vaccination services, our wellness checks, and you can get your birth or death certificate there as well. So we're really excited to be able to do that for people who may or may not be able to travel to Greensburg. It makes it maybe just a little bit easier for them. And then the last thing, and I'll cover, I know we're running out of time here, we started our community garden. It got planted on Sunday. We have a pretty good sized community garden that we just started that will be able to offer fresh produce to people who need it.
I think that's so exciting for the summer. So very exciting.
We're really excited about it.
Yeah. The health department just offers so many different things. Like I said, we're working on getting some dates set up so we can dive into each of those divisions a little more and share more information. And coming out of today, though, get your MMR, get your child vaccinated.
For sure.
Any other thoughts about the measles before we go?
Just say some prayers and keep our fingers crossed it stays out of Indiana.
Yes.
And Decatur County.
And Decatur County in particular.
It's so contagious. Yes. It can just spread so quickly. So, well, thank you both for coming in today.
Thank you.
I appreciate it. Lots of information to be passed along. And if you did not hear all of that, you can go back to our YouTube page and watch that interview so you can get all that information. It's 9:43 on Tree Country 1330. Thanks again, guys.